Have you ever been told that your labs were normal so you couldn't possibly be having perimenopausal symptoms? Today I want to explain why the FSH is not a reliable test to diagnose menopause and perimenopause and what actually matters instead. So what is FSH anyway? FSH stands for follicle stimulating hormone. In general, hormones are the way the brain communicates to the end organ. So it's like the brain is making a phone call to the ovaries, and then when the ovaries are not able to respond the way they once did, the brain calls again, and that FSH is released again. So in other words, a high FSH means that the ovaries are not able to produce the estrogen that they once were able to produce. Okay, well that's easy, right? An elevated FSH means low estrogen, and that means you're in menopause, right? Well, not so fast. It's just not that easy. Your ovaries didn't just turn on during puberty overnight. It was a process. Like that, as the ovaries start stopping producing estrogen, it's a process as well, and that's called menopause. So hormones fluctuate. That's what makes it so tricky. And it's these hormone fluctuations that make you feel the way you do. During perimenopause, the estrogen could be high one day and low the next. The FSH can swing wildly from one blood draw to the next. A single blood test is not the whole picture. It can give you a snapshot, but it's not going to describe exactly what's happening in your body. So the key point is a normal FSH does not rule out perimenopause. Many women with classic symptoms such as hot flashes, night sweats, mood swings, anxiety, sleep disruption, brain fog have completely normal FSH levels, but they're still perimenopausal. A single blood test or an FSH doesn't measure symptoms. It doesn't measure quality of life, sleep quality, mood. Menopause is a clinical diagnosis, meaning we diagnose it based on your history and symptoms, not a lab value. There are situations where I find that FSH can be very helpful, like confirming menopause in someone questioning if she needs contraception or evaluating premature ovarian insufficiency. But for most women in midlife, I often don't even order an FSH unless it would change my management. In other words, I don't let a normal FSH stop me from treating my patient if I think she's perimenopausal. Menopause, by definition, is when a woman has been one full year without a period. As you can imagine, the diagnosis can be tricky in someone who's had a hysterectomy or an endometrial ablation. When we rely too heavily on an FSH, women are told they're too young or they're not there yet or that nothing is wrong, when in fact there are treatment options that can help them. So if your body starts to feel a little different, that matters. Menopause is not a lab diagnosis, it's a life stage. In my practice, I prefer to treat women based on their symptoms rather than a blood test. Thank you so much for watching, and if this helped clarify things, please like, subscribe, and share it with a woman who's been told that her labs are normal.